Welcome back to my channel, guys. As you see in the title, today I'm going to be doing some micro needling. I am new to YouTube. Go ahead and show your support by subscribing down below. So I have a tiny disclaimer. Make sure you go and try not to do this at home. I am actually a professional, but in my state, I cannot even do this on my clients without being under a doctor. So I am doing it on myself, but I do not do it on my clients in my skin studio. So there are reasons why it is regulated, and it's best that you go see a professional to do this. I'm just going to show you what it looks like on myself. I have not done it to myself in a while. I have the perfect skin for this. So I have acne scars, old ones. My skin is not under any active breakouts where it's just angry right now, so it's like the perfect time to do it. It's also called collagen induction therapy, and this is just to help stimulate collagen, help with fine lines and wrinkles, acne scarring. So it is great all around the board. I do have some hyperpigmentation as well. As you can see, I have a nice clean face right now. My hair's tied up and I'm ready to go. So I'm going to do a voiceover on this part. I'm going to remove my glasses. That might help. So after I cleansed my skin, I'm actually going to just go over with an alcohol pad. This is 70% alcohol. I'm just going to give a nice little wipe through, kill any extra bacteria. If I touch my face like from the bathroom to my room, anything that could be on there. We just want to make sure everything's nice and clean. Hold your breath because I almost died breathing in that alcohol. But yep, nice and clean. I'm pretty thorough with my 4x4. So as you can see, let's get a close-up on my skin. She's looking kind of good, guys. I mean, I've suffered from bad acne in the past. I'm a brown skinned woman, so I get hyperpigmentation as well. I got some fine lines. I'm getting old. I'm also doing a lot of lash extensions, so I've been getting some frown lines. So it's been a while since I've done this treatment, and I'm pretty excited to do it today. I'm going to do it every 4 to 6 weeks, and I do glove up for this treatment, even on myself. Quick spray of alcohol, so I like to keep it in a spray bottle. And then this is a sterile pack of the actual micro needles. And then we're going to use the hyaluronic acid by Casa Baja. It came recommended from this girl I follow on YouTube. She's awesome for aesthetic questions and skincare concerns. Here's the pen I'm going to be using by Dr. Pen. You can get it here, and it's going to be pretty affordable in my opinion, especially for home use. You know, if you choose to go that route for, you know, your estheticians, of course, professionals, and it's very easy to use. I'm going to do a quick spray of alcohol. I want to keep everything nice and clean. You can see those needles there, nice and sharp and straight. I like to start with my forehead. I'm not going to go in too deep. Again, I haven't done this in a couple years, but the forehead doesn't really need to go too deep. It is a bonier area, and I don't really have too much scarring. So we're going to do a 0.75 on the forehead. And you're going to see me do a couple of different methods. This is kind of the box method. We're going to go in one direction in like a square shape, box shape, and then down. And then we're going to go a different way on diagonal. So this is like that box technique you can do. It is nice for covering like a whole area pretty evenly. You're going to see me do some circular motions and be more aggressive on like areas like my cheeks, which it has a little more fatty tissue in there, and maybe even the deeper lines in between my brows. So for areas that don't really need too much attention, but I still want that collagen induction, I'm just going to go and pass it over with the box method. So I like to start with my forehead again and work my way down one side, chin, and to the other side. And as you can see, I'm keeping the pen perfectly perpendicular. It is a little tough to do with the camera, but this has to be done like a perpendicular so you don't angle the needles and drag them and then injure yourself. So I'm not going for a bloody face here, guys, so sorry, you're not going to see too much blood. I don't actually bleed very heavily. In the beginning, I did my very first treatment, but I actually just, as I do it more and more, I don't really bleed too much, and I think it's just because my skin is just improving so much. I also don't have any, like, you know, I don't bleed easily in general, so, or bruise at all, so I'm pretty, you know, quick to repair here. But I do get really good results with the microneedling. And as you can see, I'm just constantly reapplying and being generous with the hyaluronic acid. I want to make sure I have a constant glide and give so that nothing snags. And then you'll see me in some areas where I kind of pull the skin taut, like my nose area. And I just want to make sure that nothing really snags the needles, and I'm keeping it, again, perpendicular. But you can see my forehead's already looking plumper and getting some pink shading there. So I really like that. That's what I'm going for. So on the cheek area, I'm actually going to go deeper. I'm going 2.0, which is deep to some people, and they'll probably need a numbing cream. But I was pretty comfortable with it and didn't have any issues whatsoever. I can go pretty deep with this and not really feel anything. But we're going to go a little closer here and just kind of see how it looks close up to see what it looks like on the skin. And you can see all the hyaluronic acid to see how generous I'm being. This is also good like for milia and to help better extract them, since you need a needle to extract those anyway. That this area usually gets affected, like that upper cheekbone, and that would be good to kind of just remove those and help those in a kind of facial treatment, again, by a professional. So here I'm going to go a couple passes because I like to get my cheeks really good. Remember, this doesn't really hurt me at all. I don't really bleed. I'll turn probably pink. And I can tell you what it feels like after treatment is more like a nice sunburn. So we're doing it right. That's what we want. And you can see here I have a large like white birthmark on my cheek. And in there I don't do any circular motions. I actually don't even get any acne there for whatever reason. I've had it my whole life, and I just don't even really worry about that area. I'm focused more on that upper cheek part. Here you can see I'm being really gentle on my nose area. I do sleep on my side, and I get these like little wrinkles there, and I can't stand it. So we're going to microneedle those today. And as you see here, I'm pulling the nose to the side, keeping that skin taut. Make sure there's plenty of serum there. Alright, so I'm going to move to the other side. And I'm working kind of fast here just to kind of give you guys a go. I did do like a box technique here, and I'm doing the circular motion. So I'm doing a couple passes on my cheek areas. Again, that's my problem area, so I don't mind going over here a few times. And since I'm only doing this like every 4 to 6 weeks, it should give me a nice good dose of collagen. And if you guys want to see a video, like, you know, a whole series of this, like before and after, I would love to. So I'm going to try to keep up with it this time. Usually life gets the best of me and I just forget to do it on time. But this is great for smile lines, the lip area. I have a scar here on my lip, and we're going to go little passes over there from when I was a kid, and it's very faint now, but you can still kind of see it. I'm going to go over with the edges of my lips here, get some hyaluronic acid in there. This does help moisturize them and plump them up a little. Some other things you could use this for, like body parts, where, you know, if you have some stretch marks, this does help stimulate collagen and help them look much more faint. But here's a close-up on the after. It looks really good. I'm going to put some more serum on here to kind of moisturize and hydrate. I didn't get any bleeding. This is just by Circadia, some vitamin C with hyaluronic acid, and here are some things to keep in mind after a treatment. The moisturizer I'm going to use for the next few days is a light aloe one by Skin Script. I do like this one, but here are the results. It looks good. I really like it. Thanks guys for watching. See you soon. Bye.